Dr. Borislav Markov is someone whose experience we could talk about endlessly. He worked at the Faculty of Medicine at the University of Novi Sad. Then for many years he worked at the Clinical Center of Vojvodina, and he was also the head of the Department of Traumatology at the Clinic for Maxillofacial Surgery. He has dedicated his career to surgery and implantology, also working on extremely difficult cases. A few years ago, he decided to fully dedicate himself to private practice and high-quality services. Doctor, good afternoon.
Good afternoon.
While reading about you online, I came to notice that patients speak very highly of you. They describe you as extremely dedicated, someone who has no problem taking their time, but also a doctor who eases the tension with occasional joke or a gag. Among other things, you have also decided to record these videos especially for the patients so they could be more comfortable when they're coming here for the procedures.
Yes, we are really trying to give our best in our practice to give the best quality of material and best quality of our knowledge to reach the procedures which are usually the normal procedures in all the best clinics in the world. I'm trying in communication with patient to find what is the solution that patient expect so that I can suggest the optimal solution of the problem. After 20 years at the university clinic, I decided to commit myself fully to my private practice, that I can give the best and the highest quality to our patients.
So this is a place where fake smiles are not up for sale. Today we're going to discuss on some frequently asked questions that patients are concerned about. So I will start with the first one. How long does dental implant treatment take? Does it hurt?
No, it doesn't hurt. We usually do that under local anesthesia. Patient can feel some kind of uncomfortables and something like that, but some pain or something, this is not the option. On the question how long the procedure lasts, I cannot say some precise answer. It depends, of course, on how many implants do we need to put in the jaw or jaws, and also is it necessary to make some additional procedure like augmentation or sinus lift or something. We usually are placing one implant for, I don't know, 15 minutes or 20 or half an hour if there is no other procedures that are needed to make.
And how soon after the extraction can I have a dental implant?
It also depends. Usually immediately after extraction we can put an implant, and usually we can also put temporary crown that the patient can receive some satisfactory aesthetical result immediately or a day or two after the extraction. But sometimes it's not possible. We have to make some other kind of temporary prosthesis or some other solution, and we have to wait for 3-4 months, maybe 6, if there were some augmentations, some bone augmentations of jaw, and it is very personal. So we are trying to, in communication with patient, to try to find the best solution, some optimal solution for the reconstruction of the patient teeth, or let's say occlusion, and to give the best solution for the patient. It doesn't, sometimes it doesn't mean that we have to put an implant. Sometimes the best solution is not an implant, and it also depends on patient medical records and the medical situation. If there are some kind of diseases or some conditions which are not suitable for implantations, we also trying to find the best solution for that patient. So this answer cannot be very precise, but we are trying in first on the first examination with the patient to discuss with the patient what are the patient expectations, and to give the best solutions, and to explain what are the good and what are the bad sides of all that solutions, so that patient can go home or somewhere else to think about that, and after that to come and say, doctor, I think this is the best solution for me, and let's do something.
Here in Serbia, Markov Dental Clinic is known for a very detailed treatment plan and for the commitment to the patient. So is it possible to know how many dental implants do I need?
We can discuss about the number of dental implants only after the clinical examination, and after the analysis of 3D or combined CT scan, and then to discuss what is the best solution for the patient. It doesn't mean that one implant is necessary for one tooth. Sometimes we can make total reconstruction of all the teeth in one jaw with 4 or 6 implants, or to make some prosthesis which will be connected to the jaw with the 2 implants. So it's really personal thing, and depends on 2 things: the resources of the jaw and the expectation and the wishes of the patient. So I have to emphasize that it's very important to find the optimal solution for the patient according to his expectations.
Why are dental implants more cost efficient in Serbia than the rest of the world?
You can get here in our clinic the best implants. We are using only 3 brands, which are one of the 3-4 best in the world: Ankylos, Nobel Biocare and Straumann, at the lower price. It's just a question of market.
When we are searching about dental implants in Serbia, we can see that costs vary here too. Why are the prices of dental implants in Serbia so different?
There are 2 main reasons. One is the quality of implant, also the price of the implant. And the second one is, I think, maybe more important, it is the knowledge and experience of the doctor. And that is the reason.
What are the advantages of dental implants comparing to alternative solutions?
Dental implants are not only aesthetic solution. The implants are the most similar thing to natural tooth. They give us possibility to reconstruct the natural occlusion much better than the other solutions. Also, dental implants sometimes preserve the natural bone in the jaws and give us possibility to treat our patients in the best way for the patient. It is very important in the communication with the patient to give the real informations about the procedure, and to find what are the patient expectations, to find the optimal solution for the patient.
You have many patients from all around the world. And how does this procedure look for the patients abroad?
Patients usually send us an email requests about the prices, and they expect us to give the precise price about the procedures, but only according to some pantomography, X-ray or something like that. It is important to know that as we are committed to give our best quality and the real prices, that we need to make some clinical examination and to receive and see and make analysis of 3D CT. After that, we can say only the approximate price. And when we see the patient and make an analysis of 3D, then we discuss with the patient what is the solution, what is the time necessary for the procedures, and after that, or what are the costs about that procedures. But it is important to understand that only with in discussion with we are not the factory of the teeth, and we are trying to give our best and to commit personally to every patient and give the best solution for all the patients, but according to his expectations.
Markov Dental Clinic is a clinic fully committed to the patients and to the quality. Their knowledge is giving them opportunity to work on very difficult cases. Trust is very important here, and dedication is one of the highest values. You can contact us for any information that you need or any question that you need from the doctor. You can see our email here, and you can send a message or anything that you want to ask us. We are really hoping to see you at the beautiful city of Novi Sad.